Well, the PLUMB trial is a Phase I, Phase II trial we've been undertaking at the Royal Marsden. In this trial, we recruited patients who either had locally advanced disease or metastatic urothelial cancer with an in-situ untreated primary tumour. And we've examined the combination of local hypofractionated radiotherapy with Pembrolizumab. The trial's gone through slightly checkered history. We started off giving a dose of 36 gray and 6 fractions with Pembrolizumab 100 milligrams. But then we hit dose-limiting toxicity, so we had to redesign the study and use a lower radiation dose. We went down initially to 24 gray in 6 fractions with Pembrolizumab 200 and again got dose-limiting toxicity. So we ended up with a final fractionation of 24 gray in 6 fractions, which seems to be very well tolerated with very limited toxicity, no dose-limiting toxicity, and then we undertaken a dose expansion of that regimen. I think one of the lessons from that is that there may be some interaction between immunotherapy and very large doses of fractions of radiotherapy, and at least that's what you see in the lab, and it seems to be in our clinical experience, at least in the pelvis. But when you reduce the fraction size down to 4 gray or less, then it looks like you can manage that. So that's an important message, I think, for future trial design. The efficacy results from the study were quite encouraging. We had a 50% overall response rate, which is higher than you would normally expect with IO alone, and that may support our hypothesis that the radiation may act as an immunotherapy priming agent. And so the interaction may be synergistic. We're still working through some of the dose data on local control, but we've got good bladder symptom control out at 3 to 6 months. We had a progression-free survival rate of around 7 months and an overall survival rate for the patients with about 19 months. Though we had locally advanced tumours, only 3 out of the 28 patients were in that group and everyone else was metastatic. And we continue to have 3 patients who are over 18 months out who continue on treatment.